Doctors, nurses, and hospital staff, they're always there to help us when we get sick or hurt. But more and more, they are becoming victims at the hands of those they are trying to heal.
Workplace violence is a big issue for hospitals. Today, during Hospital Week, Chesapeake Regional Medical Center is addressing staff concerns with an event focused on stopping it. 10 on your side, Stephanie Hudson has that story new at 5.
Well, healthcare workers are 5 times more likely to be injured in the workplace than any other industry. Whether it's patients lashing out or their loved ones of patients being aggressive, the behavior is increasing.
When you go to a hospital, it should go without saying.
Shouting, cursing, threats, and other forms of verbal abuse towards staff is not appropriate in a hospital.
The Virginia Hospital and Healthcare Association created this video.
Neither is spitting, shoving, kicking, hitting, slapping, grabbing, and improperly touching caregivers
because of escalating attacks.
We have had healthcare professions that have their injuries have been so severe that they've been out of work for long term.
Chesapeake Regional Healthcare gathered its employees at this violence prevention fair to focus on stopping it.
I always tell our workforce that, your priority is looking out for the patient, but in the event you're injured, who's going to look out for you?
Speakers included the Commonwealth Attorney, who vows to prosecute those who come after healthcare workers, and local law enforcement, who offered self-defense classes like this one to healthcare workers.
So you can feel more confident walking from the parking lot to here, and if there's anything within the hospital.
The hospital now has a sheriff's deputy in the building 24/7. That, along with special staff training to de-escalate emotional situations, has helped create a safer workplace over the last year.
The number of incidents that have resulted in harm have dropped like a rock. So they've gone from like 40 to 10.
And with campaigns like Help Us Help You,
behave appropriately in clinical settings, it is in your best interest.
The goal is to stop the violence completely.
Now, under state law, it is a Class 1 misdemeanor to threaten to kill or harm a healthcare professional rendering care. Federal legislation is pending now in Congress. Stephanie Hudson, 10 on your side.